Welcome to the ILCM training course Liver Cancer. My name is aftercare and I'm part of the operating committee of the International Liver Cancer Movement, ILCM. Today we focus on aftercare program. It's my pleasure to have Bruno Zangro, an international well-known expert with us, and Michelle Tolley, a UK patient who also cares for patients. And I guess there are a lot of questions. Let's start the sections. And Michelle, your first question to Bruno.
Hello, Bruno. Could you explain how rehabilitation works, please?
Rehabilitation is an essential part of the treatment of a patient with liver cancer. Cancer affects daily life in many different ways, not always related to the impact that the cancer has in the organ, in this case, in the liver. So you may feel symptoms that are derived from cancer, or you may feel symptoms that are derived from the treatment of cancer that may impact the way you can perform in daily life. And rehabilitation can help you make the most of your capabilities to run a life that is as normal as possible, not only during the time you are in treatment, but once treatment has hopefully and successfully finished, be part of an absolutely active environment thereafter. It's an essential tool for any liver cancer program.
And what's psycho-oncology, please?
Is another important part of the care for patients with liver cancer. Not only because, of course, the diagnosis of cancer has a strong impact in the way we feel, but also because and tackling that would result in a better way to cope with the burden of liver cancer, but also because we know that addressing well the psychological problems around the diagnosis of treatment of liver cancer results in better survival. It's not only that you live better, it's also that you live longer. This is why it's so essential.
So my question here is, how can family and friends support and get support from?
We are human beings. We do not live alone. We do not want to live alone. And any diagnosis of disease, but even more importantly, cancer, and in this case, liver cancer, is not a personal problem only. It's a family problem. It's also a society problem. And it's absolutely critical that your environment as a patient, your family, but your friends also, the teammates where you work, all of them may be helping you throughout the process of the treatment of cancer to do this journey in the best possible way. Again, this not only impacts the way you feel, it also impacts the way you receive the treatments, the way you cope with the symptoms, and in the end, the way you obtain the best benefit from therapies.
Yeah, I agree with that actually, because I find that myself, I found that swimming, actually quite a lot of swimming, helps me. It helps me focus on something positive. Also reaching out and speaking to people. I do run a support group for a different reason, but we do have many people in there that have liver cancer, and it's educating. It's not only educating yourself, it's educating your family, your work colleagues, because it has a big ripple effect on lots of people's lives. And if people don't understand what liver cancer entails, it's very difficult for loved ones to deal with that. So I would really urge anybody to try and reach out to any local groups online. There's many groups online with like-minded people, because there's nothing better than speaking to somebody who's already walked in your shoes.
And Michelle, let me ask you,
Yes.
don't you feel that it is necessary to make health systems acknowledging that this is an essential part of therapy that should be provided beyond systemic or therapies or surgery or whatever, not only tackling the tumor, but tackling the patient?
Yeah, absolutely. I mean, you need a healthy lifestyle, as healthy as you can be. Even when you're feeling at your poorest, it's to try and be positive. Eating in a good, good diet also makes you feel positive. Again, with trying to find one activity, like I say, I found swimming to be the one for me, and reaching out and speaking to people. I also like to advocate, and I like to help and support people, as best I can, because I know what it's like, and just by helping one person is, I can't even put it into words, but reaching out and speaking to people. There's plenty of people out there that are willing to give you an olive branch, listen. And sometimes when I listen to some of the members of the group I run, it just makes them feel so much better. So yeah, reach out, definitely.
And I guess, Bruno, so to jump in here, your proposal would be excellent. And I guess one of the things is that the international guidelines of ASLD, EASL, APASL, and ILCA can really push that there is a combination of scientific expert support and patient support, and both provided to the patients is the best option and should be also recovered by the health insurances of the countries. Dear both, thank you so much. And we have a global audience, and I'd like to finish this section with one last sentence from you both. What is your recommendations to the patients in the world? Bruno, I'd like to start with you.
My recommendation is be optimistic, find the right place to be treated, and rely on medical expertise to make the most of what science has been providing over the last years and is able to provide now in terms of therapy.
Thank you, Bruno. And Michelle.
Okay, so reach out. Don't be afraid to source support groups. There'll be people that have walked in your shoes who know how you feel. They'll understand how family members are feeling. Try to help educate yourself and learn the impacts, also the effects on family members, which is very important. But definitely reach out, speak. There'll always be someone there on the other side who'll be too willing to have a listening ear to help.
Dear Michelle, thank you so much. And dear Bruno, also, thank you. It's great to have you here and to help us. And if you, dear audience, are interested to learn more about liver cancer, please go to www.ilcm.global. See you soon.